Tonight on this story, we're taking you along for a ride on a MAX train in downtown Portland. This month marks the start of a new law that cracks down on drug use on public transit. It's a crisis riders have been facing for years.
It's pretty bad. You can usually smell it on the trains.
They really huddle themselves in corner seats.
So instead of providing medical care, what we're doing is sending them through a criminal justice system for just using on here.
How first responders are enforcing these new penalties. It's our big story tonight. January 1st marked the start of that new law, Senate Bill 1553, which makes using hard drugs on public transit a Class A misdemeanor, the most serious kind of misdemeanor, which means people can not only be arrested if caught, but they can face a more than $6,000 fine and 364 days in jail.
Wow. I'm kind of on the fence about that. I think that there's a greater need for mental health care, not jail time, because that's already overloaded with other things.
I think there should be a good, approach to stop abusing the system or the public transportation.
The fact that they're spending time and effort on this instead of focusing on housing right now, people are using drugs on here because they have nowhere else to be. There's no other supports out there. So why are we penalizing what is a medical condition, which substance use is, instead of providing the medical support?
Now, we also talked with a guy who rides the train every day, and he's also in recovery, and he has a slightly different view.
I think it needs to happen. I actually am a recovering addict. I have been clean for 3 years.
Congrats.
So I know, thank you. I know what it's like, and it once it gets you in its grip, it doesn't matter. Like, it doesn't matter where you are. It doesn't matter who you're with. It doesn't matter if there's police around. You're gonna do it. And so I think it'll help a lot. I do think they'll have their hands full.
We also hit the streets of Old Town to talk to people addicted to drugs about why they use them on public transit. Here's what one guy had to say.
Partially because of warmth. A lot of times, especially the homeless, are getting on the train because it's freezing cold, and they're wanting to get on the train so that they don't the wind stops, so they could get a steady flame on the friggin' thing. There's very few in the way of narcotics that I haven't tried. They have no plan for actual treatment, actual care services, recovery. It's just terrify people and leave it at that.
All right, so that's what those in the community have to say about this new law. Now, just a few hours ago, TriMet's general manager, along with Multnomah County leaders, including Sheriff Nicole Morrissey O'Donnell and the new district attorney, Nathan Vasquez, held a news conference to talk about how they plan to enforce it. We'll have DA Vasquez joining us for a live interview in just a minute. But let's start with the leader of TriMet for his take.
So let me be very clear. Drug use has always been against our rules here at TriMet, but however, when possession of small amounts of hard drugs was decriminalized in 2020, it resulted in unclear direction around the legal enforcement of these rules. The changes passed in the last legislative session made it clear public drug use cannot be tolerated on transit systems. Those caught using drugs on public transit vehicles now face stiff penalties. And those who qualify will have a pathway to recovery through state-funded treatment and supervision. Public transit must feel safe and accessible for everyone.
So far, in the 7 days since this new law has been in effect, there have been 0 arrests, despite the sheriff acknowledging today that, yes, people have probably been using drugs on public transit in the past 7 days. They're asking riders to report to TriMet Security if they see people using.
Understand, it's been 5 to 7 days, and there has not been an arrest at this point. Drug use will not be tolerated on public transit, and those individuals engaging in this behavior will be held accountable. The Sheriff's Office oversees the Transit Police Division, which is comprised of approximately 21 deputy sheriffs and police officers. When incidents are reported, the nearest security team or a police officer can respond when a police intervention is necessary. We are committed to continuing to work with TriMet, the District Attorney's Office, and all of our partners to ensure a safe transit system for everyone.
TriMet officials also say their safety response team is riding transit, doing outreach to connect people with mental health and addiction services.